Hi, I am Dr. Vishwarup Roy Chaudhary, and a small 5 minutes demonstration I will show you which can help you come out of the trap of diabetes and other lifestyle illness. Diabetes is not a disease, it just means high sugar in your blood. How much sugar should be called as high sugar? To understand this, focus on this demonstration. Assume that this is a total blood, about 5 to 6 liter blood of your body. Also assume that at this moment there is no sugar into it. If I add 1 spoon of sugar, that is about 5 gram in your total blood stream, and now if I check the blood sugar, the total reading should come about 100 mg per deciliter, which is equivalent to about 5.6 millimole per liter, which is absolutely perfect. This means you are not a diabetes patient. Now imagine I add 1 more spoon of sugar, that is about 5 gram more, and a total amount of sugar which is running in your bloodstream right now is about 10 gram. At this moment, if I check your blood sugar, the reading should come about 200 mg per deciliter, which is equivalent to about 11 millimole per liter. Even this is a safe range. You should not be categorized as a diabetes patient. Now assume that I add 1 more spoon of sugar in the existing 10 gram of sugar which is already running in your bloodstream. This means a total 15 gram of sugar running in your bloodstream. At this moment, if I check the blood sugar, the reading should come about 300 mg per deciliter, which is equivalent to about 16.7 millimole per liter. Surely, now you are a diabetes patient. Now, if you want to reverse diabetes, that means you have to take back that extra spoon of sugar out of the blood and throw it out of the body. If you can do it, you are again a non-diabetic person. Presently what is happening, most of the people, to get back the normal blood sugar level, they are taking the medication. And what the medicine does, medicine takes the excess sugar from the blood and it hides that excess sugar under the heart, or it throws the sugar in the kidney, or it takes that sugar back of the eye. This means causing long-term complications like heart disease, kidney failure, retinopathy, cataract, glaucoma, etc. Now the question is, if these medicines causing more harm than any good, why these medicines are in the market? Most of the diabetes medicine, whether it is metformin or sulfonylureas, these medicine came in the market before 1960. Whereas FDA brought randomized control trial in picture after 1962. Randomized control trial happened after 1962 when the medicine were already in the market. And all the randomized control trial, whether it is UKPDS trial, advanced trial, ACCORD trial, and even the recent one, that is VADT trial, all this trial comes to one conclusion, and that is diabetes medication reduces your blood sugar at the cost of making you more sick, at the cost of increasing the mortality rate. As a result of this, on 6th of March 2018, ACP, that is American College of Physicians, they released a new guideline, and according to that guideline, if without medicine you are able to maintain a blood sugar less than 250 mg per deciliter, which is equivalent to about 14 millimole per liter, then you are in a safe range. You need not to worry about your blood sugar level. Question is how we can do it. You can do it by adopting a DIP diet. If you want to know about the DIP diet, if you want to adopt DIP diet, then you can go to the screen, that link you can see on the screen, and you can read my book called Diabetes Free World. It is a very small book. You can complete it in 25 minutes and you can learn the DIP diet. And I encourage you to follow the DIP diet for next 3 days, that is for next 72 hours. And the result I can predict with my experience of last 10 years on as many as 22,000 diabetes patients, that 90% of my patients, they were able to free themselves of diabetes medication within the first 72 hours. And if you are on insulin, then most probably within the first 3 days you will be able to taper the insulin by about 50%. So here I want you to pause the video, apply DIP diet in your lifestyle for at least 3 days, and come back to this video and start from here again. Hi, I assume that you have already gone through the book, learned the DIP method, and most likely that you have followed it for 3 days. And especially if you are a diabetes patient, I know the result that for most of you, as much as 90% of you, the result should be you are free of the medication and still you are able to maintain a blood sugar in a healthy range. And if you are the one who had been on insulin for several years, this means that by following the diet, by third day you should be able to reduce the insulin need by at least 50%. And also I've seen those who are type 1 diabetes patient and recently diagnosed, as much as 40% of them could free themselves of total insulin need in the first 1 month to 3 months of following the diet. The story of all other illness is same as the story of diabetes. If you are suffering from heart disease, if you are suffering from kidney failure, if you are on dialysis, if you are a patient of cancer, or if you are taking the medicine for thyroid, then I can tell you that there can be a customized diet which can help you as a food, as medicine, so as to taper down the medicine to zero, and that means you can be free of the trap of medication, you can be free of the trap of the disease, and you can lead the rest of your life medicine free and disease free. To achieve it, I can help you. You can go to the link given in the screen, and the only thing you have to do is you have to fill the DAM form, that is diet and medication form, so that I understand about you, about your health status, and I will make a customized diet for you, a customized diet which will be suitable for your medical condition. And also I'll give you a prediction how much time it will take to be free of medication, how much time it will take to be free of all the complications which happened in last several years by consuming these kind of medication. But if you are the one who want to learn the trick of using food as medicine, then I want you to join a very special online training program called Training on Advanced Nutrition by Lincoln University College. This training is of 3 months, and in this training not only I'll train you how you can cure the lifestyle disease using food as medicine, but also how you can cure infectious disease like corona, etc. If you are the one who is also interested to handle an emergency situation kind of thing, then I will encourage you to join a very special program, a short program called the Code Blue Training by Lincoln University College. And in this training you learn how to handle a situation like chest pain, heart attack, cardiac arrest. Especially in cardiac arrest, you must understand the first 4 minutes are most important, and that will decide whether the patient is going to live or die, and that all depends on your skill. You can save a life, and this training is not similar to BLS or ACLS training. It is much advanced training. Some of you may be interested to learn more about diabetes and how to handle the complication and how to taper the drugs, how to taper the insulin. For them there is one more specialized training program, and that is called Diabetes Educator Certification Program from Research Institute of Complementary Health Sciences, Vietnam. This is under the license of Vietnam Ministry of Science and Technology. So if you are interested for this training, then you can go to the link given on the screen, and this training takes about 3 to 6 months to learn, and you will get a certificate straight from the Vietnam. I hope that this training can help you to get the knowledge which can be helpful to save a life. I am Dr. Bishwarup Roy Chaudhary. All the best. Thank you.